Good morning. Thank you for having me.
You know, as a parent, sometimes you deal with things with your kids and you're like, oh, it's just a fever. Oh, it's just a heat rash. But when is there times to say, there's an alarming situation here?
It's absolutely common that you can have a viral rash with fever, maybe a stomach ache, and then you see this rash come on. Sometimes it'll actually precede the illness. Other times it'll follow that illness. You really want to worry when the fever is very high, not responding to medications, or if there's severe diarrhea, or maybe some sloughing of the skin. Look for peeling of the skin around the mouth. Then you really want to get concerned.
Doctor, how is this? Is there a certain virus that is more susceptible maybe to having this kind of skin reaction?
There are numerous viruses that are associated with a skin rash. One of the most common ones we're all familiar with before was chickenpox. Now we have hand, foot, and mouth. We have a lot of viruses like enterovirus, Coxsackie virus, but even the common flu can cause this. And it's a weird thing. I like to give the analogy that it's pouring down. So sometimes it'll start on the face and the trunk, and then just when you think it's starting to get better there, it'll pour out of your limbs.
Is it itchy? Like, is there medication that can help with that as well when you see those rashes?
So these rashes can sometimes be just visible, minimally itchy if they are. They're often not painful, and it's more the frightening sight of them and not so much their feeling. Good over-the-counter recommendations are over-the-counter hydrocortisone cream or calamine lotion, and honestly, it's just treating the virus symptoms with supportive care.
So is this just kind of a reaction that the body has to someone getting the virus?
Yes, when your body is fighting a virus, the immune system is getting ramped up, and sometimes it has some mistaken inflammatory components within the skin.
So once the rash is coming and you see that on your child's skin, does that mean that it's close to the end of the virus affecting the body, or is it right in the middle?
So it can present itself before, during, or even after. So most of the time that we see concerned parents is their child has gotten over the worst of that flu-like virus-like symptoms, and then maybe 8 to 10 days later they start to develop a blotchy rash all over. And that's when you know, okay, maybe I just need to take some extra precautions with respiratory, droplets, making sure they're not contagious.
You kind of touched on this a little bit, but when do you know when maybe this is something that you need to go to the doctor for?
So I always recommend going to the doctor if some of your supportive measures like Tylenol, rest, chicken soup, if those are not helping and the patient or the child is getting very high fever that's really intractable. If you have any symptoms of sloughing or they're just sort of getting worse and your supportive care isn't helping, it might be time to get in. There are new antiviral therapies that can help.
When you say very high fever, what's that number?
Usually we say 104.